Welcome to Recovery His Way. I'm your host, Tom Reynolds, and today we're with two good friends that we're getting to know, Wendy Reeves and Carl Wilkerson. And we're glad to have this conversation. We're excited about this conversation, getting a chance to meet you and learn what you are doing. You know, His Way has been involved in recovery. I've been involved with it for about 25 years, and His Way specifically for 15. And I know a lot of other people have been involved in various aspects of addressing this issue. We obviously have a residential program. We've been working specifically in that, but there's a lot of avenues. And so I'm glad today to have both of you from Partnership for a Drug-Free Community to share with us. So I wanted to start with just kind of share about what Partnership is about. Why was it formed? How did it come about? What are you all's objectives?
Okay. Well, Partnership has been around since 1988, and it started with a grant from the Junior League.
Okay.
And it started out, initially the name was Partnership for Youth, and after they hired Deborah Soule as the executive director, decided that the name really needed to talk about the mission, which was drug-free and youth. So Partnership for a Drug-Free Community was born shortly thereafter. It has always historically been a youth, drug, alcohol, tobacco prevention, education, and awareness agency. Have always had worked with schools, youth programs, and also the community, having town halls and forums and creating coalitions and things like that. A real long history. We could talk forever about all the things that we've done over the years. And in 2017, shortly after the death of our founding director, Deborah Soule, I was at a town hall in Madison, and there were parents talking about losing their adult children to overdoses and that they didn't know where to come. And I'm like, why didn't they call us? We've been here for 30 years.
Right.
And then when I got back and we had a staff meeting, I'm like, well, if they called us, what could we tell them? Because it was obvious to me at that meeting that this was a real need in our community. We have resources like you. Mm-hmm. People just really didn't know how to find those resources. Right. So we started doing research. We put together an advisory committee, and then our Recovery Resource Hub program was born. And that involves, we have peer support specialists, we have clinicians. The key thing that the State Department of Mental Health said that at that time that we really needed was an avenue for assessments that qualified people to get into state-funded treatment.
Okay.
And so that's our goal, is to try to help, especially in the substance use community, try to help people who have no resources, anybody who maybe otherwise would fall through the crack. We help everybody. Mm-hmm. You know, we help people who have insurance as well, but the majority of people that we work with are people who don't have any resources.
Right. So you started out kind of educational. That was your, I assume, educating youth at not going down this path, basically at some level. And then you've kind of now gotten into networking people who are out struggling with substance abuse, trying to get them into assistance. And so assessments and that kind of thing, being a network. How do people, like if I have a substance abuse problem, how would I find what you do, and how would I know that what you do would help me get connected with resources? How does that happen? I mean, do people just call you? Is it okay?
It's pretty simple. I mean, we do a lot of news. You know, we're in the news a good bit, but we have a website, we have social media channels,
right?
But basically that calling us on the phone, and it can be even if someone has a family member that's struggling and they don't know what to do, because I think a lot of times these situations are far more stressful for families than the person that's actually dealing with the addiction.
No question. Right.
And sometimes they just need some guidance, because I'm sure, as you've seen throughout the years, a lot of times, I remember before we officially started the hub, we had a call, and it was someone who said, well, we're going to have a sit down tonight, and we're giving them an ultimatum that they have to do this.
Right.
And I had to explain, well, you can do that, but it's probably not the best idea, because, as you know, the person needs to want it for themselves in order for it to work. So we still do the education component with our youth, but we're also trying to educate the community as well.
If I were a school, okay, and I assume, what ages do you kind of focus on in terms of your education? I mean, do you start high school? Where's kind of the target for you educationally?
So with our main youth programs that we have right now, one is our Youth Tobacco and Vaping Prevention Program. That is funded through the State Department of Public Health. It involves the Stanford Medical School curriculum, and it's for students in grades 5 through 12.
Okay.
On that. And then we have our Aussie opioid prevention programs, and that's really from kids in grades 2 through 12. There's 3 separate curriculums for that program, and we can customize it. It's basically a 4 to 6 week program that the students go through, and it's not just educating them about what the drugs are, but there's also self-esteem and components of that nature as well, peer pressure, all those things. It covers a lot of different
Right. Yeah, because those
things in
are ultimately the issues that drive the use of those things. That's good. That's good. So, do you, as you work in this program, I guess, do you go to like the public schools, at private schools? What schools do you hit? I mean, what kind of groups do you go to? Junior, you go to kids programs? I mean, how does all that happen?
We go anywhere that we called.
Okay.
When we started we've been in the tobacco prevention has always been, because a lot of times that's the first place that kids are introduced to substances. So for many, many years, Partnership's been involved with that. Funding for the program went away, it came back in 2018, and so we started back. We had to kind of rebuild some of those relationships with some of the schools, but they're calling us regularly now. We already, in the month of October alone, have already taught more kids than the requirement of the grant, because of the need from our teachers and things like that.
Awesome. That's great. So you're the director. So I guess your job is kind of overseeing this and managing the whole thing. Carl, maybe you could share about what your role is in this. How did you get involved?
Well, I got involved with Partnership, I think it was like 2019, 2020. Initially when we started the Resource Hub, which is basically the clinical assessment side of Partnerships.
Okay.
Right now I serve as the Recovery Services Director there, so our basic duties is I manage our clinical team and support level staff. I've always worked in addictions, and kind of in the middle of my career I transitioned over to mental health, and thinking that the two to some degree were separate. And once I transitioned over to mental health, I found out that the two are just gonna, they're intersecting each other.
Keep running the same things, right?
Yeah, you can't separate them.
Right.
So at that point, it was kind of the light bulb went off to me. I said, well, if we don't fix one, we're not going to fix the other. At least if we don't address one, there's no point in addressing the other.
Right.
So you got to have both. You got to address both so that person can be healthy. So fate would have it, I ended up joining the Partnership team as an assessor, and from there it grew.
Okay. Well, I want to go back a little bit. I mean, why did you choose to get into, I guess, counseling was your field of study? I mean, how did you get into this whole thing in the first place? Why did you get involved with addiction, substance abuse type issues?
That's a wild story. but collegiate, like any other kid, you're going to college, different majors and whatnot.
Where were you going to school?
A&M.
Okay.
Alabama University.
Okay.
And I originally started out as an accounting major.
Okay.
And,
well, that explains why you go into substance abuse right there. I got that.
Got into accounting, and just that passion wasn't there. Everybody likes money, but some people like myself just don't want to devote their lives to just counting things.
Right.
I ended up changing majors. I ran into this young lady at lunch, and conversation sparked, and she said that she was in area social work. And of course, what is that? And, one thing led to another, and I got into that program and found out that, hey, this is where I belong. Graduated addictions-wise, had really basic, limited knowledge of addictions, and I ended up getting a position at the mental health center back then, which it's now Wellstone. And I ended up working at a treatment center, and from there I got surrounded by a lot of knowledgeable people, and it grew just from there, and it just kind of took on a life of its own.
So your background's in social work.
Yeah.
Explain to our audience a little bit about what's the relationship between social work and counseling? How does that work? What's a social worker's role? What's a counselor's role? How do those things work together?
They, in essence, the further you advance in education, they eventually end up kind of doing the same thing. But at the training level, social work is more of a holistic view of the person, rather than target specific issue. So kind of you treat the whole person and the problem fixes itself. Whereas counseling, on the other hand, will typically pinpoint a particular issue to address, and from there, hopefully we improve, the symptomatology of whatever's going on with that person. So, just the social work's whole premise is treating the whole person, so that whole biopsychosocial model.
Right. So one of the things that you emphasized a minute ago, I want to kind of go back to, is the idea that, you had kind of been working the addiction thing, you were going to slide over to the mental health side. Pretty soon you found that these two things are converging, and if you don't address one, you don't really get to the other. So why is that the case, I guess, one, and two, what's your approach to trying to bring some kind of solution here?
Well, just kind of simplifying it, the foundation of all mental health is basic needs. Just that whole Maslow's hierarchy chain of needs, food, water, shelter, safety, security, self-esteem, love and affection, so on and so forth. So you find out in society where people avoid of those things, it's going to create discomfort. And naturally, just being human beings, anytime we're in discomfort, we try to soothe ourselves. Some people soothe it in healthy fashions, while others soothe it, with all types of vices, addiction, smoking, and whatnot. So in that sense with mental health, you have to get back to the basics. And that's one of the first things we do when we go in treatment. We take a human needs assessment. What are your basic needs? If your basic needs are not being met, then it's going to be problematic when we try to address your issues, because if those foundational needs are not met, it's just going to drive you back to what you were doing before, to soothe yourself.
Right.
Usually that's drugs, alcohol, behavior, whatnot. So. And that's kind of going back to where social work is, that treating the whole person. Let's meet the basic needs, and then from there we build on it. So, but those two things are going to collide. Until we begin to meet a person's basic needs, housing, food, water, safety, shelter, those kinds of things, it's going to be very difficult to treat addiction and or improve mental health.
Right. So, we got, obviously, His Way got involved as a residential addiction recovery program. So, part of the way we've solved this is we recognize people need a residence. We provide a residence, we provide food, we provide transportation, we provide jobs, we're providing all those kind of things. So, so that we can help them then address the addiction and substance abuse things,
Exactly.
that type of thing. So, is that the solution you would recommend? Or what are the challenges, I guess, in facing that?
Well, usual challenges are, it's becoming harder and harder to meet basic needs. In your case, you have a facility that helps a person meet those needs on on that interim basis, and as they grow, hopefully they'll maintain some stability outside of there, and you can help them meet those basic needs once they leave.
Right.
The problem is that costs. A lot of times people don't have the resources to meet them.
Right.
And here we are back on this revolving
Right.
cycle. So we're going to have to find a way to help people, from the base level begin to, move to a state of sustainability. Once they're able to do that, usually you see an improvement of mental health, getting them connected with healthy support systems. Usually when you put those two things together, you see people gravitate more to that than drugs.
Okay. Outstanding.
And one of the things this year we've been part of the Elm Foundation's Pathway to Sustainability training. And that's where we have a really small staff. We can't really accommodate full-blown traditional case management, but we're utilizing community tools so that we can, when somebody finishes treatment and say, for example, they need help completing their GED or something like that, we can refer them to a community partner who can help with those things. And that's a big need in the community, but it's great that we have a tool that we can use to do that. So that's an area that's a concern, but that's a way that we found to try to start addressing that.
Right. I appreciate that holistic approach, and because so many times, people say, well, they just have a drug problem. They say quit doing drugs. If they just quit doing drugs, everything else takes care of itself.
Sounds so simple.
Right. And in some ways, that's kind of true, right? Because, if you spend all your money on drugs, you don't have money to pay your rent. Those kind of things, they start kind of being counterproductive here. So certainly some of that's true. However, the problems are deeper. And that's, from our point of view, from a Christ Center program, we're really trying to address the spiritual needs that are involved too and get to those core issues and then build out. But recognizing, and we have a case management department, recognizing that helping them deal with their legal issues, helping them deal with their health issues, getting to the doctor, getting to the dentist, and those kind of things are all a part of this whole picture. And I think it's important that people recognize that. I know in talking with people that want to get involved with this, even at a rudimentary level, it can be daunting because it doesn't take long before you meet somebody and all of a sudden they don't have a place to live, and then you figure out, well, okay, we can invite them to church once a week, but I'm not sure we're ready to house them every day, so, and that becomes a challenging proposition. I think one of the things that you guys are doing, which is so wonderful, is connecting. There's a tremendous amount of resources available, and most people just don't know that they're available and don't know how to integrate that. And I appreciate the hub that you're creating, right, that helps make that happen. As you've been involved in this, is there any other kind of, as you've watched this thing develop in our community, are there any other things that you perceive are kind of real pressing issues right now to you that you really, this is kind of the thing we really need to hit? This is the kind of thing, I know the mental health thing is a big part. Anything else that you see that you're really facing right now? You I guess, do a lot of assessments, and so you're seeing these people firsthand and walking them through this process. Any other issues that you say coming up? We're kind of in this, right, this national epidemic, right? We're seeing overdose rates off the roof because of fentanyl issues and all that kind of stuff. So I know, just the Tuesday night, we had the prayer vigil downtown for those who have lost loved ones, over the last year. And so it's definitely a community awareness. Anything else that we can be doing here that would be helpful?
The one thing that I see majority of the time with our, and the people that we meet as far as helping them get into treatment, especially when we do an assessment, the one thing that stood out over the last 3 years is housing. We tend to think homelessness is, the image we get is a person living in a tent, a homeless camp, stuff like that. But that's not always the way homelessness looks. Homelessness can sometimes look like, a person sleeping on a friend's couch, and I may be only able to stay there for a couple of months or a couple of days, or a family member letting me stay there transitionally, but now I got to move to someplace else, or even sleeping in my car. So, and we're having increased numbers of different levels of homelessness, and how long can a person be homeless, and not meeting basic needs before I'm going to need another way to kind of cope with this. If I got to be in that environment, I got to cope with it, because if I don't cope, I don't survive. Well, in comes drugs. And the one thing we know is that drugs do a great job at helping a person cope. However, it destroys them very quickly in the process. So, we're going to have to wrestle with that at some point. How are we meeting the needs of housing? Not just in the Huntsville community, Madison County community, but literally nationally. So this isn't just indicative to our community; this is happening everywhere. Right. So
probably other places worse than here, right?
Exactly.
So you guys are having a great impact in the community, and obviously becoming a real center place. People who are watching today, people who locally, how can they get involved? What can they do to help? Is there a way to help? A lot of people, especially this Christmas season, people are thinking about how to help. Obviously, you have end of the year donations and things like that. But what ways can people contact you, get involved, and really, joining you in this effort?
Well, there's. You're right, donations are always helpful because we're a nonprofit and that's what we depend on to provide all these services. We don't charge for anything that we do. And but volunteers are also important to our organization. Right now, we're actually trying to, we have enough volunteers at this point that we actually need somebody to help us manage those volunteers. So that's something that we're trying to kind of work through right now. So that's a big need that we have.
When a person volunteer to do what?
So there's a variety of things. I mean, we could have someone help answering our phone.
Okay.
From that to, we have special events where And that could be anything from a fundraiser, but also to town halls. We're hoping that in 2023 that we're able to get back to in-person town halls instead of we've been doing them virtually through Facebook Live and YouTube and things like that. But our plan is towards the end of January, we're planning the first one. And so there's always needs for volunteers at those things like that. We do a lot of outreach events, so even helping us get those materials prepared to go would help, because you saw our office not too long ago.
Right.
We're very busy,
Right.
and we're small, but we make it work, you know. But having help doing some of those things would be very beneficial.
When you said town halls, I'm interested. So, like the one in January, the town hall has a topic?
Fentanyl and other emerging, because what's happening right now, we talked about this a little bit. What's happening right now is we're seeing fentanyl even now crossing over into the vaping problem. So we want to address all of those things. There were some students in Mobile that we know of that overdosed, and we've already had some of our schools have reached out to us about, hey, what kind of fentanyl program can you bring us? And so we're in the process of the Aussie program. Fentanyl is an opioid,
Right.
and it is covered in the Aussie Ops program, but we're developing a toolkit for parents and for students and things like that we can take into the schools to help if they need help with fentanyl education
Okay.
specifically, because it's very scary,
Yeah.
very scary.
Yeah, absolutely. As you look into, you mentioned town halls, as you look into 2023, are there other initiatives that you're really focused on right now? You're excited to get involved with, ways that you're bringing your efforts to help the community in unique ways?
So we have, like I said, we have a lot of outreach events that come up throughout the year, whether that be we participate with Asha Quran, Thrive with their song. We do a lot of different events. There's, if you look at the calendar on our wall, there's stuff in there for every month. So there's a lot of things. For us this next year, for the last 2 years, we've had a fundraiser. It's a fire truck challenge where people get together and they put a team of 10 people together and they pull a 48,000 pound fire truck 100 feet.
Oh, wow. Pulling the fire truck.
And this year, we always have in September, we have a recovery resource fair. And we invite all of the treatment providers in the area come out, and we set up tents in front of our building, and the community can come up in a very non-threatening environment. We make it, it's just it's like a fair. I mean, it really is like a fair. You know, you can come out. We generally have a guest speaker, and this year we're talking about. We haven't gotten everything planned for the fire truck pool, but we are thinking about inviting all of those partners to come out at the fire truck pool as well. So it will be an even bigger engaging kind of thing for the community.
Right. Well, that's great. Well, one last thing as we close, I'd like to maybe just share with us kind of is there a phone number, email address, website? What are the things that would be good contact points for people to reach out to you?
So our website is partnershipforadrugfreecommunity.org. It's very long.
Right.
And there is a hyphen between drug and free there. Our phone number is 256-539-7339. And you can reach us we have hub email, that's hub@thedrugfreepartnership.org or info@thedrugfreepartnership.org.
Okay. Well, again, I want to thank you for coming. I appreciate being able to be partnered with you in this battle. I know that there's a lot more resources needed. I appreciate what y'all are offering, and the hub and the centristic way that you can kind of bring people in with a need and get them to sources of help. So I appreciate that, and the education you're doing with our young people to kind of help keep them from this path in the first place. So thank you for your effort. I appreciate you listening and watching today, Recovery His Way. If you'd like to learn more about our program at His Way, check out our website at hiswayinc.org.